Have you or your parents received glossy invitations for complimentary gourmet dinners, promising pain relief and a blissful retirement? These events prey on retirees, often offering free meals in exchange for sitting through pitches about so-called regenerative therapy. I'm Dr. Tammy Penhollow, a double board certified joint and spine care physician with precision regenerative medicine. In this video, I'll expose what's really going on behind these dinner seminars, why these unapproved treatments are dangerous, and how to protect yourself or your loved ones from falling victim to these misleading promises. So why do people who are retiree age get preyed upon? You're thought to be wanting to sail off into the sunset and get back into the activities that you postponed for so long while you were working, and prey upon your vulnerabilities that you're starting to get some aches and pains. You're starting to feel the osteoarthritis or maybe the spinal stenosis, and you want something that can keep you out of the operating room and into activity. Well, I get that, but these complimentary, space is limited, if you're married, bring your spouse, are targeting. They want you to be there so that you can both sign on the dotted line at the time. You can't use the excuse of, let me ask my husband, or let me ask my wife, or I'm going to have to think about it. They are emotionally targeting you, playing on your fear of pain, your loss of independence. And they're going to list a whole bunch of topics. It's going to cast this huge wide net: cartilage tears, neck and shoulder pain, hand, wrist, and elbow pain, knee and ankle pain, lower back and hip pain, arthritis, latest therapies working with chronic conditions. Wow, who doesn't have a little of that, right? So it makes you feel like, oh, there's something for me to go for. I'll take that. Fine print they don't want you to read is in this teeny weeny little aspect here at the very bottom. It barely can read in gray, whereas the rest is in black, and then the tiniest little font, it finally gives the disclaimer. It says, not FDA approved. And it says, for educational purposes only, loophole. So what are they really selling? Really, they're selling birth tissue products. These are illegal. These are not FDA authorized in the United States. There are two states, Utah and Florida, which I will not dive into because even those individual states are now having the FDA, which is nationwide, come in and say, this is not legit. So here's the deal. There are no FDA authorized birth tissue products for musculoskeletal conditions. And a doctor, chiropractor, nurse practitioner, physician assistant, naturopath cannot say, well, I'm just using it off label, because there's no on-label indication. There is no legal use of these products. So if that's not enough for you, know that there are people out there who are selling these cells in a vial from Wharton's jelly, placenta, amniotic fluid that are dead. The cells are dead. There aren't stem cells in those cells. You think that, oh my gosh, wouldn't it be amazing to take cells from a baby who was just born who can have the better stem cells? Very much could be true, right? But they're dead, so they're not effective. So don't play upon it. And don't believe, I've busted the myth many times, as have so many researchers, that the older you get, the less stem cells you have, or the more ineffective your stem cells are. With the right preoperative optimization and education and nutrition and the right harvest, you can absolutely get those cells from yourself. So they are also often administered by unqualified non-physician practitioners. Be cautious. They're also claiming false promises of eliminating pain and restoring your retirement dreams. This is dangerous. Patients may waste thousands of dollars on ineffective or unsafe therapies. There have been massive infections that have come from those vials. There have been absolutely no benefits that have come from those vials. Again, they're dead cells. We need you to think about evidence-based, image-guided, precise treatments using your body's own cells. This is not pixie dust. You can't get it from a vial. You can potentially harness your own cells with optimization and transparency. No bait and switch. So don't be swayed by free dinners. Ask the hard questions. Is it FDA approved? Are you a physician? What cells are being used? Are they my own cells? Who is doing this? Will there be a consult? Will you be looking at my imaging? How many cc's, right? Vials of blood are you drawing? If it is my blood, I seriously doubt it. These are not FDA authorized, so that makes me think they're coming from a vial. Please share this video with friends and family to protect them. Please subscribe for more fact-based education. If you have any questions, please respond below, and I look forward to answering them. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.